Welcome to part 2 on hand therapy after stroke. If you haven't already watched part 1, I do recommend that you do that. It's quite long, around 30 minutes, and if you watch that first, some of this will make more sense. At the very beginning of part 1, I touched on an anatomy idea that we're made in layers. And I used the glove to illustrate, in a way, the layers of gristle, if we can call it that are underneath the skin, that are part of the way that all the arm, shoulder and muscles around the base of the neck attach to the hand. And as well as thinking about that, we can go right back to the 16th century. An early anatomist really drew this chart, which many of you will be familiar with. You'll often see them hanging in the doctor's office. And they're really, if you put skin back on this person, there aren't many people who really look like that. And if you look under the skin of most people, they don't really look like this. This is a schematic. And we often nowadays liken this to the idea of trying to get around London on foot by using the tube map. If you travel by tube, it works really, really well. But if you're traveling on foot and try to get from one station to one that looks like it's next door, you might have a long walk and a lot of stairs to climb. So this is a schematic, and it's really one kind of map. It's got lots of fancy Latin names on it that tell us where we're talking about and show off how knowledgeable we are. Yawn. Many of you will be familiar with drawings like this too, and this is drawing of the skeleton. But what is it? Well, I'll tell you, it's just pretty much the deepest layer of our onion. The tissue is much harder, but also don't think it's rigid. Skeleton is quite bendy. In life, it isn't easy to break bones. People do all sorts of falls and tumbles when they have healthy bone without breaking them. So then it's much better, certainly for our purposes, to start thinking about the anatomy in terms of the nervous system. And that is the key, because in the nervous system we accept that the muscles in this hand are connected very directly to the muscles in this hand. If I shut my eyes, I can make a pretty decent stab of connecting the two. So in a healthy nervous system, for the record, I haven't had any strokes or head injuries, anything like that. In a healthy nervous system, one bit knows where the other is, just as well. Coordination of all kinds, not least for our purposes, walking would be, well, it just wouldn't work. So let's, instead of thinking about just muscles and tendons and joints, let's also remember to think about the nervous system, because really that's what we're dealing with. So, but we can't directly access the nervous system. But then we can have a decent shot at hand therapy. Let's pop the glove on so we can see what happens with a layer. So here I've put my layer of gristle, or fascia is the Swiss medical word for it, on the outside, but we can see that if I add tension to this, on one side it'll pull the joint in one direction. If we add tension to it on the other side, it'll pull the joint in another direction. If we add tension in front and back, what it does is makes the joint more stable. And that's what we need to think about when we're looking at hand therapy and making sure there's enough mobility. In the first video I talked about the position of safety, and it's true the basic positions that I talked about there need to be achievable. But if you really want good movement in the hand and affect the function of the elbow, shoulder, certainly up as far as the neck and the head position, then some of these things better be taken care of. Now we can look into the web space and make sure that this is supple enough. So we can work on our hands, flexibility here, pulling down. We can make sure that the joints go back as far as they're meant to, as well as coming close to that right angle that I talked about. So we can do that here, these three web spaces, but of course very important is this web space, and making sure that on a stroke hand, stroke affected or most affected as I like to really call it, most obviously affected hand, that this web space is stretchy enough. Most people after stroke will have, if it's a fairly severe stroke, they're going to have a little bit too much tension, at least in some of the muscle on the inside of the forearm here, or if you look at it in terms of medical drawings, they're the muscles on the front. These ones, the flexors, there's usually a little bit too much tension or just not enough stretch. So one of the things that I like to make sure is that all of this tough gristle isn't disrupting the position of the wrist joint. Because if the wrist joint is pulled out of alignment, it's just not going to work as well as possible. If your wrist isn't working well, then getting anything to happen in fingers and hand is a major uphill. So you've got to take care of some of these things first. And the simplest way of doing that is with the strong thumb and push up into the fold of the wrist, making sure that the skin and the gristle from here can stretch down into the hand. So that allows the wrist to come back into its correct alignment. Now, I often liken this to a car having its tracking done. If you've been a car driver or anybody in contact with vehicles, you'll probably have heard of ever so often the car needs its tracking done to make sure that the wheels, they're not vertical, they're tipped inwards, I think, at a slight angle, to make sure the wheels are at exactly the right angle. If somebody bumps a curb when they're parking and they do some slight damage, we say that the tracking is out. And if you do that and you don't know you've done it, you find out later because the tyre wears on one side. Many of you will have experienced something like that. In terms of human anatomy and function, what that means is if the joint isn't well aligned, then it can't move freely. So we better make sure our tracking of our wrist joint, other joints too, but this is a particularly common one after common problem one after a stroke, because of this common situation where there's too much tension or not enough stretch on the muscles along the inside here, the flexors. And if it's severe, you may see a very clenched, fixed fist that's overly tight. This video is aimed more at people who are getting some recovery of their hand use, and they're a little bit further on. If you've got the severe kind of flexibility problems and over tightening, then that's really a video for another day. But some of the ideas and principles in this one will still apply. So we must take care of our anatomy of our hand, make sure there's enough stretch here, and understand that one of many things that anchor this are strands from shoulder, elbow muscles, right up into the neck. And many of the anatomy trains group will say that mechanically the muscles in this hand and the forearm here are actually anchored over here, and that our muscular system is almost like a spider's web all across our body, with strands going all the way from here to here, from our heel bone to the top of our head, and even around onto the forehead and all the way around. So it's a much more linked system than Vesalius in the 16th century could really tell. And part of the reason for that is I often call this fella peeled man, but that's exactly what they did. To look at this lot, they took off the coatings of gristle and fat and skin to look at it all. And I would argue that they threw one of the most interesting bits in the waste bucket in order to try and get at this lot. So the whole suit of gristle that we wear wasn't originally looked at, and that actually didn't even really kick in properly until around 2007. We didn't know anatomy until 2007. We thought we did, but we hadn't understood it fully, anything like. And what you can say now, in the 21st century, is that anatomy is a work in progress. We're a bit better with the structure, but really how it all works together, there's still quite a bit of mystery in there. In the end, what I say is, if you want hand recovery, you better take care of what happens at the elbow, the shoulder, certainly around the root and base of the neck, the rest of the spine. Balance. Do we normally use our arms and hands for balance? You bet, especially for really nice walking. You want good pace and improved stride length and things like that. Hand care is still going to be really important. So do take care of it. Dig. Ask your physical therapist. I hope you're still working with a physical therapist or occupational therapist. Ask them, prod them. Get your questions answered. Thanks for watching. Do like and subscribe and hit the alarm bell if you would like to hear more of this kind of content. I'll do my best to put up interesting stuff. And the channel's still really small at the time of recording this, which is early 2024. If you put up questions or put up small videos of problems that you've got, I can look at them and I can start to try and create better content for you.